Hello, everybody. Welcome. Welcome, welcome. We're just letting everybody roll in and we'll be starting soon. Thank you for joining us for this conversation. I see we've got a few coming, and maybe we'll give it just 30 more seconds, see if anybody else arrives, and if not, we'll get this show on the road. We all just kind of settled in, and we're ready to kind of have this incredibly titillating conversation today for sure. Just okay. I think we're pretty complete. I think we are. How do how do the three of you feel? Do we feel ready to start, ready to rock and roll on this one? Right? I'm seeing thumbs up everywhere. Okay, that sounds like a plan to me. Hello, everybody. Thank you so much for joining us today for our monthly titillating talk. And this one, I think, is going to be especially titillating because we are talking about some really charged, but I think current and very, very present issues in the moment that are affecting us in real time. And so today we are going to be talking about reproduction. Oh, we are going to be talking about reproduction, STIs, and all the things that happen in between. What is it to be? I don't even know what we want to call this. It's an interesting time. I think that what we are talking about is very much shaping the face of our world. And we are going to talk a little bit more in depth with that. And before I go any further, let's do some introductions. I'm going to offer in as well, maybe some trigger alerts. I think I should just mention that as well. We're going to be talking about some, as I mentioned, some highly charged issues like sexually transmitted infections or diseases. We are going to be talking about reproduction. We don't know exactly where those conversations may take us today because we kind of move and flow. But if you find anything that we discuss a little bit triggering or something that may make you feel heightened, just please be aware that one thing about doing these online is that you can always kind of just remove yourself from the space if needed, mute yourself, and just take a moment to resource. We will also please be sharing some resources in the chat as well in regards to, if you need a moment and somebody to talk to, they'll be available in the chat. And just let one of us know if you're feeling something highly triggered. Please put it in the chat as well. Somebody will be able to at least direct you or hold some space for you as we move forward.
Sorry, just real quick correction. I think we still don't have a chat, so.
Oh, so yeah. The chat is not available. Okay, I am going to correct that. Please take a moment to resource offline if you are feeling challenged, if something happens. We will put resources on this link afterwards to make sure that if you need somebody to talk to, you'll have that availability over in those moments and in that time. And know that if there's anything that does bring anything up, we are here to hold the space. If we can't, maybe even put your hand up if there's a moment that happens, because I still think we do have that ability, Mo. We have the ability for people to put in just a reaction, or if they need a moment for assistance, and maybe then we can figure out ways around that as well.
I think that's the case.
Okay. It looks like, if you're wondering, Zoom did an update, so it made things a little bit different. So we're figuring it out as we go along in real time. And taking it from that point on, I just wanted to offer up just an acknowledgement as well to the land, to the space that we are in this moment. We just want to honor the holders of the land, the caretakers of our lands, which are the Haudenosaunee, the Wendat, and the Anishinaabe of this region who hold our land. I want to acknowledge them from the space of holding them, because often with land acknowledgements, one of the challenges that comes up is there's this reminder sometimes of what has been lost. And I want to really relate it back a little bit to the spaces of our truth and understandings as settlers, as displaced people on this land. I want to bring it back to the understanding that the challenges of our missing and indigenous folks are shared, in so much as that it is a challenge that hits in different ways. This reverberation of what we think the conquerors or the settlers may have taken actually takes from themselves. And I just want to offer that when we are thinking about our roles and our spaces, think about what it is that you are bringing to the land, what you bring to these moments, and what the deeper conversations are that we need to have when we talk about what are the needs for this land, because I think that's also a part of this conversation as we move forward. And with that, I would love for us to have some introductions. Who wants to go first? Okay, I'm gonna pick. How about we start with Lydia? Lydia, please introduce yourself and let us know who you are and why you are here.
Thanks, Kerry. Hey, everyone. Good evening. My name is Lydia Collins. My pronouns are she, her. I've been working in sexual health education for about 7 years, focused mostly on gender-based violence prevention, sexual violence prevention, and HIV prevention. So that's the work that I've been doing, and particularly with Black communities in Canada has been my biggest focus in the roles that I've held. I currently work, not representing them tonight, but I currently work as the gender-based violence prevention coordinator for the Canadian Centre for Gender and Sexual Diversity. So again, at the forefront of my work is always trying to find ways to center pleasure and harm reduction when we talk about sexual health, rather than just fear and abstinence. And always trying to incorporate race and racism as key components of sexual health education as well. So that's a little bit about me and why I'm here tonight. And I'm happy to be here.
Yay, that is fantastic. We are happy to have you. There's going to be a ton that we got to discuss, so I appreciate you so much. I think I am going to save Sarah for last, and I'm going to roll into the wonderful Terica Larmond. Terica, tell us about yourself and why you are here today.
Okay, well, I'm a mother, biological, and I have many children that are not biological. I'm a nurse, a midwife, a healthcare administrator, an education administrator, an educator, and I carry many other hats that might not be relevant here tonight. I'm with St. John Ambulance because guess what? Healthcare has been my passion for 30 plus years. And I've gone through various aspects of healthcare. And I think one of the most, if I should try and balance what I like best, I think my passion lies more in obstetrics, midwifery. That's where my passion lies. When you talk about delivering babies, you call my name. I'm ready to go. Yes, I've delivered many, and I still think there are many more that I can deliver. Currently, I'm at St. John Ambulance as an instructor trainer and client instructional services rep. I do a lot of healthcare, first aid, CPR. I still am an educator. I still do some leadership. I still do some administration work. So I am, should I call myself multi-potentialist?
I love that word for you. Because it's very true to who I know you to be. And definitely, I'm really excited because one of the things you didn't mention is that you've done birthing all over the world. And so we're going to have some conversations about how and what that has looked like. I can't wait till we get there.
I'm
And
also, sorry,
uh-huh,
Kerry, but I'm
yeah,
also the project assistant for Out Niagara wage funded project. So
how how could we not leave that one out?
I
We could
can never
not
leave
leave that.
that one out. And of course, working with underserved or marginalized people is also my passion.
Yes. You do so much. You do so much. Thank you for that uh, introduction, because I know we got more to go. Definitely. And I'm going to roll it out to last but definitely not least, the wonderful Sarah, Sarah B. Calling you Sarah B now.
Hi everyone, my name's Sarah Burtch. Pronouns she, her. I'm with Positive Living Niagara. I what do I do? I just blanked on what I did. How about that? I'm the Women's Community Development Coordinator. So for those of you who are not familiar with Positive Living Niagara, we are an HIV service organization and harm reduction service organization in the Niagara region. And I am here to help co-moderate and just absorb all of this amazing information, because I am so honored to be part of this discussion today. So this is going to be great.
It is. It is going to be an amazing conversation. And I just realized I probably didn't really introduce myself at the beginning of this. And I'm not going to spend too much time with it. But hi, I'm Kerry G. I am also known as Kerry Sutra. I am an intimacy and relationship coach, and I specialize in offering trauma-informed spaces for racialized folks of the melanated majority to be able to heal and to come back into their bodies, especially when we deal with all the intergenerational and colonial traumas that we have been through. I am also the proud chair of Out Niagara, one of the co-sponsors for this event, along with, because I was told, and I'm going to remember this time to mention that this is a shared space that is co-sponsored by Positive Living, the Niagara on the Lake Library. We share this space with Niagara Justice. We also share this with Brock and Operg. All contribute to keep these conversations rolling, and we have been completely funded and sponsored by the WAGE program, which has offered us the ability for us to even be here. This is actually a product of a bigger project that I'm so proud that we have gotten a chance to be involved with. So with that being said, let's get down to this, because the conversation is juicy. I wanted to talk about, I wanted to try something. I was thinking about doing this in like a, I don't know if you've ever heard of the show Jubilee. It's a YouTube channel, and they kind of start with, they have difficult or challenging conversations, and they normally do it by starting with a statement. So I got a couple of statements that I think we can work with and, you know, see where the conversation takes us. How does that feel for everybody? Does that feel like it resonates? All right. So the first statement I wanted to talk about or mention is not having children is selfish. Yeah, see, we're gonna make it easy. We're gonna make it easy. Can we just take a moment? I'll repeat it. Not having children is selfish. Anybody want to comment first?
Can I say, I would not say it's selfish. And I'm speaking with the other hats on.
Right.
Coming from a medical background, there are many factors. There are many situations that we have to look at when we talk about reproducing. Sometimes it might not be in the best, it might be the mom might want it, or the person might want to have a child, but from a medical perspective, it's not in their best interest. So I would not call that selfish. I've seen it happen too many times where they wish They've tried, but it never happened.
Yeah.
And there are many factors. So I would not say it's selfish.
I love that
Some of
response.
us have tried,
Mm-hmm.
and we brought pregnancy to maybe first trimester, second trimester, but we lose it.
Yeah.
Not because of anything that we have done, but sometimes because of the natural acts.
Mm-hmm.
And sometimes there are other factors that cause us to have a loss. So I would
And
not say not wanting to have is selfish.
I want to hold some space for that. I really do. I want to hold some space for you and others who have, you know, had miscarriages or lost pregnancies, because the question itself, I think, it is charged, but this is such a complicated. It's a complicated issue, and I wanted to start with it because it brings that up, that there are many different sides to how we stand in these spaces. And you just brought up one that is very real, Terica. For many women, there are complications that come up. And it's not always that simple just to say, let's have a child, or even if that desire is there, that's something that can be afforded. Pregnancies, in fact, are one of the most high risk, challenges that women can have. It's not like you see sometimes in the movies where you just have a belly and you can roll it and we come through. It is one of the things that put women at risk. So I thank you for that share. It's very real. Has anybody else got anything you want to offer?
The word, on the other hand, when I think of people who make an active choice to not have kids because they don't want to, and I think about that word selfish, it makes me think, well, let's reclaim the word selfish then. If selfish means making informed decisions about my body, about my life, about my wellness, about the kind of trajectory of my life that I want, then yeah, let that be selfish, right? When it comes to making the choice to not have kids, right?
Great.
It makes me think about, especially for Black folks, I'm always like, we've been selfless enough. It's okay to be a little selfish. If you're not hurting other people, it's okay to be a little selfish if it comes to your wellness. And so yeah, it makes me think a little bit about, what do we mean by the word selfish? How do we each internalize that word? How do we think about it? What does it feel like? What does it look like? How do we maybe reclaim it? So yeah, that word stands out for me a lot in that sentence.
I hear you on that one, and I hope we can flesh that out a little bit more, because I agree, it's interesting. Sarah, thank you for sharing, Lydia. Sarah, what are your thoughts on it?
So you already know my thoughts. Yeah, I can't believe you started with this one.
I was like, we're gonna go all the way. We're gonna start.
This is just gonna take us through to the end.
Throw it all in.
So, I mean, that whole assumption that the only way to be able to give back to society is by having children. Some of the most selfless people I know have no desire to have children because they have so much to give of themselves to the community, to society. But also, and again, Kerry, you already know we've had this conversation, that just in terms of that is one of those sort of things that we hear over and over and over again to sort of push people into having children, to support a system that really does support families, first of all. I mean, it's what they're, oh my goodness, I'm just gonna go. I mean, at the in terms of producing humans to be factory workers, to be that's really what they're looking to do. Is when I hear that word, that's the first thing that pops into my head is, what are you really doing? Because at the end of the day, look at so many of like the policies that are out there that don't allow us to even care for these children. Look at the environment and what it's doing in terms of the overpopulation, and what we're doing to our planet by having all of these children. So these like pressuring people into like having families or larger families when they might not necessarily want to. Not to say that I'm opposed to having, if you want to have 10 kids, have 10 kids. But in terms of that notion that it's selfish, I think we need to also kind of look at, like, what is the underlying current, that why is that pressure there? Why is there so much focus on on reproducing? And for me, it comes down to a control thing. And again, go back to both what Lydia and Terica were already saying. You know, people should have that autonomy. People should have that right to make that to people know what's best for them, and should have the autonomy to make those kind of choices based on their own experiences. I'm going to stop there because I could go for a while.
Well, I love it. I love it. I love it so much. And yes, you know, I have been privy to know some of your thoughts, and actually many of the thoughts that have already been shared. I think they're all valid. And what comes up for me is, you know, we really have to examine it, just as you mentioned, the whys. For example, I just was reading a statistic today that it costs 200,000 plus in North America to raise a child, to feed them, clothe them, you know, do all the things, give them stuff, pay for education. All of that is $200,000 for the life of a child. And as I was thinking about it, because I have 4 children, one of the things that came up for me as I was doing this research was around the space of how things have shifted. There is a sentiment, and I love that we've got kind of a range of folks on this call, where we're all women who have been around for a bit, you know, and up and coming, and where there's a range here. And what I think I love about that is that it's easy for us to see what dynamics have shifted. For example, I know when I was growing up, I was a child who watched Dynasty and The Cosby Show. And so my impressions were that I could have everything. I wanted to be Alexis Colby, but I must say I used to roll with Dominique Devereaux. Like, I wanted to be Dominique Devereaux / Claire Huxtable, because she was the lawyer. She had her 5 kids, even though it was 4 at the beginning. Did you know that? It was really 4 kids in the beginning. And then no, it was 5 kids. And then they rolled out 1. Anyway, somebody went missing, or they added a kid. Anyway, you know, I remember thinking, look how she had everything. She had the career, she had the children, she had the beautiful house, she had, you know, the education, the husband. I truly believe that that was our truth. And even though, you know, and it had to be like the full picture. I couldn't have stopped at just having the house and the kids. It had to be all of it. And woe that you didn't have that arranged by the time you were 25. Like, in my world, we were old maids. I remember this conversation I had with a girlfriend of mine. She called me in tears, just crying, because it was 2 days to her 25th birthday, and she didn't have a boyfriend she had just met her boyfriend, but like, she wasn't sure where it was going. And so there was no proposal. And we had decided, like, by 25, you needed to be engaged. If you weren't, who were you, right? And I think about that, like, that was the early 90s. And since that time, you know, I have children now that are that age. And for many of my children, they would be like, are you, do what, where, married? Are you kidding? Like, it's just such a shift in the dynamic and in the ways that we see the realities of how this works now. And I think that that's the key. You know, what I see is that as we have education, there's studies that show this, that when you have education and you have opportunities, the desires to have children normally may still be there, but you will postpone, you may forego, or you just do not do it at all. And normally you have smaller numbers of children when you, depending on how highly educated you are. And that speaks to me. That speaks to me as well, that women are very much, we've been shaped to be one way, but as we are being afforded more equality in the systems that we exist in, and again, we still got ways to go, because we know that it ain't, I can't even do this. It's kind of still like this. But as we are afforded more opportunities, women make different choices. And whether that is right or wrong, I don't think we can judge it. But I think that I love the idea that we have opportunities.
Kerry, I just want to jump in because we do actually already have a raised hand.
Oh,
So
I see it. I love it. Sure. Let's talk to, it's Kai. Is it Kai?
Yes, it's Kai. Hello, everyone.
Hello, Kai. Pleasure to have you on.
thank you for being patient.
Right?
Oh, I'm enjoying it. Thank you for having this panel. And there's no way I could be amongst so much greatness and not. I wanted to. So one thing, since we're kind of throwing questions out, if you guys at some point, so on the other end of that, I'd like to talk about, because so when having conversations with other cultures, African, a lot of the Caribbean, is it a Western thing that an age limit has been put on pregnancy? Whereas, talking to like these African mothers, and they were like, it's not like that in our culture. If you want a baby, you have a baby, and you do hear of women having children, 40s, 50s, I mean, even 60. So, and some people may say, oh, that's selfish. So it's different. There's that word again, but just from you guys' medical experience, just at some point, that's kind of why I joined. And I wanted to just know about, things that you can do just to help prepare your body. And because I've heard different medical advice. One, they say dealing with fibroids, you should have the fibroids removed. But if they're not bothering you, you should leave them alone until you're done having your kids. So those were the two things that I was hoping would be touched on tonight for me.
Wow, Kai. Love it, and love it some more. Thank you so much for the questions. I'm actually just wanting to reframe, make sure I've caught your questions 100. One I'm hearing is that you are interested in knowing from different cultural perspectives, for example, from an African culture or West Indian cultures. Is that something that maybe is not necessarily applied by all cultures, the idea of having children, because children can be had at any age? And I'm also hearing about you wanting to get some information or some suggestions around what medically can be done for women, especially if you have fibroids, which is such a common thing in the Black community. So I'm going to leave this one because I know we've got some actual medical expertise on a couple of levels there in Terica and Lydia. And I'm not sure, Sarah, if you've got some of that you can throw in. I would love to hear what you guys think. What are your thoughts on that? Did I get it?
Just to give clarity really quick. Yeah. It's not so much, I guess I'm asking, is that just a westernized mindset that we've been taught, hey, if you don't have kids in your 20s and 30s, then, and I am a mom, so, I can give birth, and I love being a mother. And so just really wanted to hear, hey, especially we have some, what do you call them? The birth mothers?
Yeah.
I heard she introduced herself, Miss Terica. She's a, what's it called? Not a birth mother.
Midwife.
Midwife. Yeah. So just let me put it in a nutshell. In a nutshell, pregnancy in later age, 40s, late 40s, pregnancy, you know, other than what I read with all the caution and all of that. And with fibroids, should you have them removed? But if they're not bothering you, you should leave them alone and have your babies and then take care of that if it's needed.
Can I jump in here, Kerry?
For sure, Terica. I was going to say, take it away, T.
Okay. Is it Kai, you said? Well,
Yes,
yes. Each individual has their own peculiarities. Now, from what we talk about most times when it comes to having the fibroids removed, of course, it's going to be dependent on what your assessment is by your obstetrician or your gynecologist, whoever your healthcare provider is. They will decide whether or not it should stay or you should remove it. But we know that during pregnancy, hormones can cause growth of those fibroids. It depends on the number, the size, where this fibroid is located. Because sometimes it might just be in the muscle. Sometimes it's sitting right in the uterine cavity. It's going to impede pregnancy because it grows during pregnancy. So it depends on where it is, whether muscle or the size, muscle or uterine cavity, or is it the size of it? There's some women who have very pinhead size fibroids, very tiny. And from my own experience, I've seen what I could consider to be a baby, the size of a baby. Having worked in OR for 11 and a half years, I've seen different size of fibroids. But I've also seen miracles happen. Because I've had patients who, it took us almost 3 hours to complete her myomectomy. She had multiple fibroids. I counted and I counted and I counted and I counted and I counted. I think I might have gotten maybe close to 400 when we were on our way out. But 3 years later, at age 40, she had a bouncing baby girl. So it's going to be dependent on your healthcare provider's assessment of what is risky and what is not risky.
Wow. Wow, I love that story. I really do.
Thank you. Any tips for women, older women? Are there any older women on here other than me that still want to have babies?
Not necessarily having the babies bit, but definitely older women. I'd like to consider myself in that category. Definitely.
Well, Kai, here's the other thing too. Some of us older women might not want to have the babies, give birth, but we want to adopt the babies as soon as they're born. Because I've had friends who've had challenges carrying a pregnancy, but in their later stages of life have gone to adopt babies. And you would say, why are you adopting a baby when you're almost 50? But for them, it means more than just a baby. It might be what brings them that joy and happiness at that time of their life. So I wouldn't say, well, we've heard stories too about persons who've had babies, maybe in their 50s, 60s. It's not a lot of persons, right? Because we know how our whole reproductive system is. After a certain age, all your hormone levels start falling off. Everything starts shrinking. If you should look at your ovaries, you maybe won't find, some of us don't have any. So it all depends too. Some persons go into menopause later, some go earlier. So we have to look at all of those things.
I would love to add, I thought you touched an interesting point, Kai, when you were talking about West Indian or like Caribbean folks and African folks, having some different cultural understandings of things. Because what came to mind immediately was my own grandmother had her last child at 47 years old. And that was the last of 12 that came from her person. And I've always been in amazement. It's just, I think again, there is some definitive cultural differences that do affect how people have and when and how they think about children. And Terica, I would love for you to like maybe go into that a little bit, because I know you as well have some experience birthing in like Africa and in spaces along that way. Did you notice that there were differences in that in when you were doing it that way too, or in Africa
Well,
too?
I think part of the thing why in the Western side, or in North America, I should say, we sort of hesitate sometimes on what age, or you have a drawback. Should I at age 40, or should I really be having any kids? Because the culture, as we know, does dictate some things. In Africa or in Ghana, where I've been and will be going back to, women, they think about a village. It's a village that cares for kids. So when someone has a child, it's not just that one person who's going to have the child. It takes a village. And of course, sometimes because of their cultural traditions, there are times when it's the old nannies, they call them, or the birth attendants who are not trained, who are the ones who must do the delivery, because it's as though they have all the experience and they're going to be there with the mom. In that culture as well, the family comes together to care for the woman in the tribe will come together to care for those kids. So there's really no hesitation on when, how young or how old, because you have the support. In North America, we have to live the busy life. We're in the fast lane. And do we really have a village that will care for these kids? I don't know.
I feel like in the Southern region, which is where I'm from, that we are more like that people. I don't know why. It's still I don't know what we lost as a people when we migrated north into the West, but the Southern culture, absolutely. Even how people cringe when you say, yes, I got 6 kids, 7 kids. I'm like, that is amazing. That's beautiful. But, I really do think, and I think it's so unfair. This is switching over I think it's so unfair to women. Like, honestly, I'm careered, I'm degreed, but for me to say, hey, I'm okay taking care of my husband and my little babies. What? And there are some women in my family that are homemakers, and the men take care of them very well, and they take care of the homes, but they are ostracized by the older females who went through the 70s and 80s. So, interesting.
You're bringing up, I think, some fabulous points, because again, not only, I think one of the things when we think about how we're seeing this systematic switch or this desire or this access to choice, a lot of it does flow around this idea of individualism and being an individual in that space. And I love that we have choice. I love that we really do have these options to decide what suits us. But with that, I also think that one of the things that's been at a loss is the idea of family. We now see birthing or having a baby as you have like a partner, yourself, and, you guys take a minute to raise your child together. But very much beforehand, like my grandmother had 12 children, but they were kind of spread out. Like she also had 5 brothers and sisters who all lived in the same village. And from what I understand, the kids just kind of flitted and flooded wherever, they could go. Whoever had whatever was doing whatever. The kids just went house to house to house. It really was the village, the family system that was extended family members that looked after and made sure that, because I mean, she had 5 brothers and sisters. So I had aunties and uncles there too. And so when you look at that, it's a very different way of being in existence. And I think that from our perspective here in North America, that isn't necessarily how it functions. It's very much something that happens in a silo, and getting access to daycare, getting access to or childcare, because I don't even want to call it daycare. Do you see where my mind automatically went? Getting access to those abilities and like having those things afforded to you is a very, very much a challenge, which keeps us in these second thoughts. So I love what you brought up, and the answers that we've received in this regard. Does anybody else have anything they want to add? Sarah, Lydia, do you have any thoughts around it?
Lydia, do you have something you wanted to? Okay. I just in hearing everybody talk, and it was really interesting in terms of like the comparison of like, in terms of culture and that kind of thing. And what was kind of going through my mind as we're having this conversation is, it really, oftentimes it doesn't seem to matter what your choice is. At some point, somebody is going to refer to you as being selfish. So whether you choose to have kids, whether you choose not to have kids, and also I was just kind of wowed when you said your grandmother had a baby at 47, because I'm 47 now and I can't even fathom that. I shut down the baby making factory years ago. After I have 3, best things I did with my life, but I shut it down. I was good at 3. And I was even selfish even after having 3, I was selfish for doing that. Many people tried to talk me out of doing that. I was like, no. But also in the sector that I work in the world of HIV, since we're talking about also destigmatizing STIs, oftentimes I think in supporting people living with HIV who are looking to, wanting to become parents, oftentimes they get labeled with that label of selfish. How could you do that? How could you? And because there's and a big part of, I think, my role, and I think Lydia probably does a lot of this too, is supporting people around having those choices and being supportive in those choices. And that is something that is not had. So not even in, there isn't that village to support people in parenting, but even just being able to support people in making those choices for them. And I think we need to really, again, look at who we deem who should be having babies, who shouldn't be having babies. You're either too young or you're too old. I had my first at 20, and I remember people going, "Oh, babies having babies." I'm like, "Oh, really?" And meanwhile, right now they're ostracizing. I forget which celeb it is who's like having a baby at 50 right now. She's glowing, she's beautiful, she's proud. She has probably all the money and the resources in the world to raise this baby. So who cares? She's probably getting better healthcare than most of us. But everybody's like, "Oh, how selfish of her." Meanwhile, a 70-year-old man can do it. But so, I mean, again, coming down to people passing judgment and deciding who is worthy of having a child, who is not worthy of having a child, and so you're going to get called selfish regardless of what your choice is. Those are the ramblings that went on in my head while we were having this discussion.
I love it so much because everything you touched is valid. And I'm going to move it to the next question on the Jubilee-esque role that we're on here. The next question is, or statement is, if you've had too much sex, you deserve an STI.
Oh, go for it, Lydia. Don't hold back. I just see your face. Go for it.
I was like, well, I think at the core of it, it always goes back when it comes to destigmatizing STIs. It always goes back to um, debusting myths, stopping misinformation in its tracks. And I think that's what I see more than anything in workshops and in classrooms, anywhere in regards to having these conversations is usually just a huge amount of misinformation. And so even just that statement alone, right, is this concept of going back to kind of as Sarah mentioned in regards to like who we deem as worthy. We have such this kind of fixation in North America on the nuclear family. So we deem certain people as worthy of having kids and certain people as not. Similarly, we deem certain people as, um, you know, being deserving of having STIs and certain people as not, right? And when we don't think about the fact that, for example, STIs aren't only spread sexually, right? Some are skin to skin contact, some are through, drug use, right? Unsafe drug use. So there's so many different ways. Sometimes it's through breastfeeding, right? Or vaginal for through birth. Some people are able to pass on things like herpes or HIV through birth or through breast milk. So again, just this lack of information around how things are actually spread. But then aside from just how they're spread and kind of debunking that, getting back to the root of, there's nothing that anybody could do to be worthy of an illness, a disease, an infection, right? Like if somebody said that they broke their arm, we would never think to be like, see, this is why nobody should ride bikes. If you weren't riding bikes so often and walking around the street so often, then you would never break your arm, right? But the second you put sexually transmitted in front of something, it's suddenly, oh my gosh, I can't believe you would do this, and this is, you deserve this. And I know people who got pregnant the first time they ever had sex. Right? I was in high school, my best friend got pregnant the first time she had sex. I was already having sex long before her. Right? I know people who, have many different partners regularly and have never had an STI, and I know people who are in monogamous relationships and have. So again, it's not a matter of worthiness, it's not a matter of your character. It has nothing to do with something that you did right or wrong. Again, it's all about kind of making people feel bad for, at the root of it, um, pleasure, right? We still, again, have this fixation on the nuclear family. We still have this fixation on sex only being something that's meant for reproduction. So even to talk about sex and pleasure in the same sentence is still, for a lot of people, a foreign concept. So to say, there's you can have sex because it feels good, right? And there are ways to do it that are safer, and to reduce harm and to make sure that you can make informed decisions about your body and do things that make sense for you. But at the core of it, you should be able to enjoy it, right? And you don't have to do it just with the expectation to have babies. And especially when we bring into conversation what sex looks like for queer people, right? Where reproduction might not even be in the conversation, depending on who you're having sex or the kind of sex you're having. And so really trying to, again, in my work, that's what I really try to put at the core of it is pleasure. And I often do workshops specifically with Black youth, talking about how our pleasure was interrupted by things like colonialism, and how chattel slavery, how sexual violence as a war tool, as a colonial method, how all of these things have kind of interrupted our relationship to pleasure, where we're over sexualized. Black women are often hypersexualized. Thinking of, again, impacts of slavery, of colonialism, even thinking about Indigenous women and things like residential schools, just having all of these conversations around, for a lot of racialized women, especially Black and Indigenous women, our pleasure and our relationship to pleasure and that concept of pleasure has been so interrupted because our bodies have rarely been seen as ours, right? Historically, and we see that still happening. So yeah, it's absolutely, as we all know, nothing to do with a reflection of character. Many people live with STIs. Over 100,000 cases of chlamydia in Canada alone every year. Most people have had it. You might have had it. Somebody has had it. Bacterial infections are common. All these things happen, right? Bodies do what bodies do, and it's not a reason for anybody to be, ostracized or treated poorly.
Sarah? Thank you, because I'm just keeping quiet in this one. I'm gonna keep quiet. I want to hear what y'all got to say on this one. Sarah?
I don't know that I could say it better than what Lydia said. So, and again, I think a lot of our stigma related to STIs is related to the stigma we have around sex. And again, Lydia already hit on a lot of those points, but also also going back to that conversation around choice. And we also assume that everybody can make choices to prevent transmission of, STIs. And that's not always possible. So there's so many things that contribute to people's ability to be able to make those choices. And that's something that, whether it's something they're even consciously aware of or not. And so playing that blame game. But the fact is, we're human beings. We get illnesses. It's just part of life. Sex is part of life. Illness is part of life. People need to get over it. That's where I'm at.
Love that, because that is so true. Again, it's that sense of normalizing what sexuality is and what pleasure is. And Lydia, I do a lot of the same work as well. This idea of bringing racialized bodies back into their bodies and back into this understanding of pleasure, and knowing that these are like natural functionings. An STI is something that you may come up against, and there are ways that we can practice and be in to be safe, but these are things that can happen, and it's okay to give it some context in that way. And I want to know, Terica, what are your thoughts? Got anything you want to add?
Well, Kerry, people go to the beach to have fun. They didn't go to get drowned.
I have to love that one.
Can I use that line in my next presentation? Because that's the highlight.
Things do happen. I mean, anyone can get infection. I have had my patient who is, Lydia said, person who got pregnant the first time they had sex. I've had patient who didn't even have a period and didn't even know she was pregnant until she delivered the baby. The membranes ruptured. Her dad thought she was having an appendicitis, brought her to the hospital. How did she get pregnant? Of no choice of hers.
Work.
She was raped.
2 hours in, my first day back.
Sorry? She was raped. Now being raped, she could have gotten more than just a baby. She was innocent.
Wow. See, and again, all the sides that exist when we talk about the challenges that can come up and around our reproductive rights. The radical acceptance that I hope we can all move into, but we also have to take into effect and to bring in and drop into the stories like what you're mentioning here, where sometimes things happen and it's not by choice, it's not through our ways, and why it's so important for us to continue to have these conversations and do the education that we need to around it. Because again, knowledge is the power. Knowledge is really the power that when we can offer that, hopefully we can change and maybe lessen the scenarios like the one you just told us, Terica, because that's real and not what we want. And I'm gonna just allow us a minute to breathe into that, but I'm gonna kind of move it a little bit further in. I want to talk about this idea of the stigma. So which one is considered more in professional opinion? Which STI offers you more of a stigma? Is it, I'm going to narrow it down because the two that really come to mind for me is herpes or HIV. Which of those ones do you think carry a bigger stigma? Or I'll leave it there. Which one carries a bigger stigma?
I think they both carry a lot of stigma in slightly different ways, but both in really big ways. I think for those two, different from bacterial infections like gonorrhea or chlamydia, obviously the obvious kind of big stigma around it is that there's no cure, right? So when people think of it, it's lifelong. When people think of things like chlamydia and gonorrhea, they kind of laugh it off. Every college student has had it. It's no big deal, right? So people don't think as much about it. But HIV and herpes are again something that people have to adjust and live with, right? I think particularly looking at it these days, right? Not looking at HIV particularly 30 years ago, but looking at it currently with the advancements, with the medicine, with the kind of more of the conversations and work that's being done around it. I think a lot of times herpes can get a different kind of rep because it's something that people expect to be very visible and very I guess sometimes a little bit more obvious, right? So if somebody's having outbreaks, there's this assumption that, oh, that's disgusting. They consider like the sores to be inconvenient, right? So it's something that I think can have a different kind of physical toll, especially on young people who are diagnosed with herpes, who are kind of like, well, am I going to be ever be able to date again? Am I going to be looked at differently? Am I going to be seen as gross or untouchable, right? So I think those kinds of things come up a lot, or at least when folks I've spoken to who have who live with herpes, who have brought up is kind of a lot of the stigma around physicality. Whereas HIV, I think there's still so much stigma around. A lot of people, it's not funny, but at the core of it, a lot of people don't know what HIV is. I'm going to be honest. I'm going to be very honest. A lot of people actually don't know what it is. I still hear people thinking that it's just like this African or disease or this gay disease or this, right, this like weird random thing and everybody's going to get AIDS. And if you touch somebody who has HIV, you're going to die. A lot of people don't actually understand how it's transmitted, what it is, right? And so I think, and it's interesting because whenever I do workshops or talk to folks about what HIV is, I kind of see that look on their face of like, oh, oh, that's what it is. Okay, that's not too bad. That's manageable. And I'm like, yeah, that's the point. That's where we're at right now. Is right. It is manageable, and telling people that like, if you're living in North America, the chances of you going from HIV to AIDS is very unlikely, unless you have, depending on your situation. But it's not as common these days for it to escalate to AIDS, right? Or that it can only be transmitted through 5 different fluids, right? You're not going to get it through saliva. You're not going to get it through holding hands. You're not going to get it through kissing, right? There's even other sexual and intimate acts that you can do that it can't be transferred through. So just having more conversations about what it actually is. And I think the part that tends to often I see a lot of like kind of light bulb go off when I talk to people about this is that it's an immunodeficient virus, right? So when we think about what that means that so I'm a type 1 diabetic, right? It's something that I've had it since I was 10 years old. It's not going away. I have things that I do to manage it, to take care of it. Right. And when we think about HIV in this day and age, and at least in this continent, it's the same kind of thing, right? It's if you have adequate care and resources and medicine, it's something that you live with, and people live long, beautiful, healthy lives with it. And we now talk a lot about U equals U, undetectable equals untransmittable. So for a lot of folks, if your viral load is low enough, you actually can't transmit the disease at all. Right? You can't transmit the virus at all, sexually at least. So again, I think just the biggest thing is more information, kind of more, just sharing very at the basic, just real information about what it is. Because I think there's just still so many, I've heard some really outlandish theories about what HIV is and then how it happens, right? And so I think kind of going back to your original question, I think herpes and HIV both have a lot of stigma. I think they both have, I think a lot of them have they both have a lot of fear around them. Like that's one thing I notice a lot. There's a lot of fear around what do I do now? And with both, I've heard people share the fear of, is anybody going to want me? And so I think that says a lot about what it means to live in the society, what that stigma looks like, what it means to bodies that we deem as worthy, bodies that we deem as not. I think it's a much larger conversation around that, around desirability, that want to be desired, and that fear of what happens when I'm no longer seen as desirable in this society, and what does that mean for my value in this society, and how will I be treated, especially for women, because women see that the second that we're not seen as useful in regards to being desirable to specifically to men in this society, we're susceptible to, in that moment, we're susceptible to violence, we're susceptible to, right, just so many different things. So that fear is very real, of what do I do now, and who's going to want me now. And I find that stigma and that fear is a lot stronger than people's fear even of dying from HIV, right? So yeah, I would say those are really huge ones that I've seen.
Great answer. Great answer. I'm going to just allow that to sink in and ask Sarah and Terica, what are your thoughts about this one? Because this to me is powerful. Like if we can get some of this information out, I would really appreciate it.
I'm just gonna thank you so much, and thank you for covering like the fluids and everything like that, because you're absolutely right. I'm trying not to giggle as you're talking, because I've been working in the HIV sector for going on 22 years now, and I still know you can't get it from mosquitoes. No toilet seats. No. So just so everybody knows, no, you cannot get it that way. It actually has to get inside of your body, inside of your bloodstream. So thank you for covering all of that, because I can't believe this many years later we still have to cover it. And it's also, and I think part of that might be even just a very much a North America kind of thing, because we don't talk about it. It's interesting going to different parts of the world, or talking to people who come to Canada, and they're like, why aren't you talking about HIV? Why aren't you talking about, we don't talk about these things. We joke about them. They're the punchline of the jokes and sitcoms and that, but that's really dangerous. So, and like not just HIV, but yeah, you're right. Like people just joke around about chlamydia, that kind of thing. But what that does, that just reinforces that stigma, and it prevents people from getting the healthcare and the support that they need. And again, what it does to people's self-esteem. And it's, I think the greatest part of my job is those people who initially, when they're first diagnosed, are like, nobody's going to love me, nobody's going to want me. And then, months later coming back in and, seeing them, I've got a new relationship, loves me for who I am. I'm seeing babies born. I'm seeing so there's so much life after a diagnosis of HIV or other STIs, but people don't know that because all they hear is the negatives again. So, and again, in Canada, that stigma is also very dangerous because we still criminalize HIV in Canada. HIV is the only STI that is criminalized. They're getting better. They've been gradually moving the scale down, and just recently, the government of Canada has been did a sort of a public survey asking people about the criminalization of HIV and getting people's opinions on that, because because we're still seeing people who can be charged for not disclosing their HIV status, and the way that law is being applied, it's not applied equally either. So again, Black and Indigenous people are disproportionately impacted by these laws. In terms of even the sentencing, it's not the way it's being applied. So no other disease is criminalized the way HIV is, and that is directly linked back to our perceptions of HIV. And it's so stigma, while that impact of people on an individual level, it's, you know, can be so damaging. What it can do, like in terms of like how it's impacted even like our legal system, and we have to really, really be careful about how we're having these conversations about HIV. People knowing what I do, I'll be in, you know, we'll still make an HIV joke, and I'm like, are you kidding me right now? Like, do you know? Like, this is do you know what those kinds of attitudes are contributing to? You know, somebody who overheard that isn't going to go get an HIV test because they don't want to know, because they're too afraid to find out their status. You know, somebody, you know, you just prevented somebody from walking into a doctor's office to get the life-saving treatment that they need to get. So these are things, these are not just funny little jokes that people are telling, and we need to take stigma seriously, and we really need to actively, you know, try to debunk all of these things. So please, everybody who's on this call or watching this later on YouTube, get informed, get information, and call it out when you're seeing that stigma happening.
That deserves some snaps to be heard. I really want us to just enforce this. Terica, I'm going to give it to you in like just 5 seconds, but I also just want to throw out there, can we talk a little bit about what have been the new breakthroughs, or why is it time for us to stop living with this high drama space that, you know, people are dying from HIV? Like, can we talk about that one as well? Terica.
Well, I think Lydia and Sarah has give it to you all. They're the ones working in the field. They have all the experience. But my 2 cents is that anyone can get STI. Doctors get STIs. Nurses get STIs. Anyone can get STIs. And sometimes you don't even know that you have these STIs because they're asymptomatic. So, I mean, it doesn't matter your sexual orientation, your race, your ethnicity, anyone can get STI. So that's it.
Short, sweet, and true. Again, like, I appreciate this, because again, I think as we normalize it, I think we have to understand what has happened. So is there, like, can we talk a little bit about why? Why is it that, or what has transpired that we've come from this idea of the fear to what the reality of that you can live a long life? What has been the changes? Because I think people are still circa 1995 and don't recognize how different the truth of it is in this day and time.
I can say just a couple. So I know, I would say a major one would be obviously advancements in medicine. Medicine that's more productive. I know, especially in the 80s, a lot of people living with HIV, when they were trying to figure out what it was in America, in North America, were taking like many pills a day. There were all these different kinds of things that people were trying, a lot of kind of trial and error. So I think a lot of advancements in medicine in regards to what actually is working for people, different kinds of medicine of, okay, people have options of what can work for them. And I will say, and I'll touch on again, the really big breakthrough in the last few years, I'd say, around U equals U. So again, undetectable equals untransmittable. So as people have been learning more about that, understanding what that is, as doctors and scientists have confirmed that to be true, that you cannot pass HIV on. If you're living with HIV and your viral load is low enough, I can't remember the exact number right now, but if it's under a specific number, which would be due to, you know, medicine, as well as like healthy lifestyle. If your viral load is low enough, you cannot pass it on sexually. So this is obviously huge for people living with HIV, huge in regards to their dating lives, their, you know, huge in regards to stigma, huge in regards to so many things. And so U equals U, I would say, would be a really huge and beautiful kind of moment that we've seen over the past few years that has really become more to the front, to the forefront. I know Katie does a lot of work around it. I know a lot of ASOs, including Positive Living Niagara, have done a lot of cool, like, initiatives and conversations around U equals U. So there's a lot of information out around it right now, more than there has been ever before. And people just understanding what that means, what that looks like. So I think that's a really, really, really big one. So yeah, I would say advancements in medicine, U equals U is another huge one. And I think also more conversations, even when I think of 30 years ago, we can see kind of how much um, anti-blackness and homophobia are drenched in HIV stigma, right? So even when we look at the way that these folks were treated by doctors who would not even touch them, would not even be in the same room as them, right? When we think of, even still to this day, we hear conversations around it being a disease that can only happen to gay men or to Black folks, whereas Terica mentioned very obviously, like you said, anybody can get an STI. And I think also we've been able to kind of um, debunk that myth a little bit about it being like a Black gay disease by showing more and more in statistics and just through conversation that there are straight monogamous couples out here who are transmitting HIV between one another, right? There are people of all ages. There are people who are born with HIV. There's so many different scenarios of all different kinds of people who can be living with HIV for whatever reason, outside of just being Black and queer, as well as holding space for the fact that we can, of course, not go without saying that there are priority populations for a reason, right? And Black folks and men who have sex with men are two priority populations. And it's not because they're inherently more promiscuous or that they're doing anything wrong or biologically there's something wrong with them. It's because of just the simple scientific fact of the kind of sex you're having, the kind of lifestyle you might be living. If you are using injection drugs and now you're not doing it safely. If you're having, again, anal sex, that's a higher risk just because anal is just higher risk for that, right? Well, it doesn't matter if you're straight or not. If you're doing that sexual activity, it's just higher risk because of the friction, because of just the nature of the act, right? And so just having the information about, like, it's not about who's doing it, it's just about kind of what's being done and why it's considered more high risk to be able to make someone more susceptible to transmitting the virus. So yeah, I think just more conversations about anybody can have it, and just understanding more about what it is and how also people can live long, healthy lives, with and despite HIV.
I keep missing my mute button. Sarah, please chime in.
So, and I'm glad, again, with the U equals U was a game changer, even for, couples who are trying to have a baby. It used to be such a process. And now it's great to see like couples who want to be, I'm like, yeah, just go for it. Do it like the old fashioned way. It's fantastic. So, but I think it's also really important to talk about also HIV prevention, and even prevention of STIs in general. Even seeking out that help stigma, how that impacts that. We have like this now. We have available to us more in our toolkit than ever before, like with pre-exposure prophylaxis, and I can't say this enough, like pre-exposure prophylaxis, PrEP, it's here, it's in Niagara. We have a PrEP clinic. It's amazing. Use it. But just, it's a 1 pill a day that somebody can take to prevent. So somebody who is HIV negative can take this pill to prevent transmission of HIV. But even trying to access it, there's a lot of stigma around that, and even having that conversation. When I talk to people about this, they're like, again, these misconceptions about, oh, well, somebody who's having a lot of sex with a lot of different people are the people who need it. And, PrEP is for people who want to take control of their sexual health. And not everybody has that ability. Even finding doctors who are willing to have that conversation and prescribe it can be a challenge. So it's not always accessible to people. So again, this whole notion around, we have this amazing tool at our fingertips and people are still having trouble accessing it. So that's something that really needs to be addressed. So again, find out more about how you can contact Positive Living. I'm going to make a shameless plug. If you want to learn more about PrEP, if you want an HIV self-test, if you're HIV positive, just call us. Just call us. Shameless plug. It's gonna.
I love the shameless plugs. I think it's important. At the end of the day, one of the takeaways is not only do you now know where you can pick up and receive and get information as well as PrEP and all the things. What I also want to leave us with is the understanding that it is okay, that we are reassessing, reevaluating, and stepping into a new way of having to be able to experience sex and sexuality and pleasure. And that the sooner we have conversations like this, the sooner that we maybe work on reprogramming or reducing these stigmas, is the better we are going to create safer communities and be able to prevent these STIs and HIV from even spreading, because it becomes common knowledge, it becomes common practice, and we will be able then to just be better people overall. It's just such a challenge when people end up isolated because they feel they can't step into their sexuality in a very real way. And it makes us sicker. It does. And I also just wanted to mention, as I was listening, I thought about another friend of mine who managed to catch herpes her very first time she ever had sex. And I remember that devastation that she went through. And, we don't talk about how common the herpes complex is, and that it's something that it too can be managed. It too isn't a death sentence or the end of the world. And I think the more we have the conversations and we're willing to stand in these spaces, we will do so much better. And so I thank you, both of you, all three of you, for this wonderful conversation. I'm going to do one more question.
There were some questions from the audience.
Okay, so we'll do the questions in the audience then, because I know I'm trying not to go too much over time this time.
Sorry for the distraction. I'm getting them on text message to me on my cell phone because this is
right. Good.
You know what? Chat doesn't work. We just found a way. That's
right.
Resourceful like that.
Oh, okay. Yes. I love it.
We had somebody had submitted a question about living with herpes, and there were now I'm trying to remember what the question was. What you would like to, I guess somebody had asked about sharing stories, if there people had a personal story, and I think there was some people talked about, but what kind of advice or what would you want to hear to support or to provide support for that person?
I love this one because, again, I think that you're touching on something. Whoever asked the question, I'm holding space for you because it is not a rare thing. It's really not. No, you're not alone in it. I know that I think the comfort I would want to offer you is that it gets better, I know several folks who have it where it's not that big a deal. Every time, normally your first outbreak, may be the worst outbreak. And then after that, it's an individual thing, but every outbreak may not necessarily be as bad. And truthfully, you know, as you start to just understand your body, there are ways that you can start to learn to deal with it. Like, you know, that whilst you're in that highly infectious time, just that may be a time you refrain and maybe have other ways to have fun. Because I also want to touch on that. Depending on where you have the herpes virus, sex doesn't always have to look like PIV, you know, penis in vagina sex. It does not always have to look like that. And especially if you are queer or you're having other ways of being, like, there are different ways we can express ourselves sexually. And so I want to offer that up as well, that we don't always have to put parts together, or at least the parts that we're expected to put together. We can put other parts together that work just as well and may give you even more pleasure. So offering yourself that grace, offering yourself that knowledge that you're okay. It's a moment, it happens, and we can move on and still have fun with it. That's my thought. Anybody else got anything they want to offer up?
I really like the kind of how you put that is, you know, it's a diagnosis is one small part of your life. It's not your whole life, right? And so just remembering that and remembering that your worthiness is not at all tied to a diagnosis. It's not tied to your sexual behavior. It's not tied to any of those things, right? And also remembering that your diagnosis is not a reflection of your character. Something that you did. You didn't do anything wrong. You didn't do anything bad. There are different things that people do all the time and don't have the same outcomes. And so it's not a matter of, oh my gosh, I can't believe I did this. And of course it led to this, because I can guarantee you 500 other people did the same thing you did and had a completely different outcome, right? Could have been luck. Could have been a million things. Who knows, right? So there are people who, I have friends who sometimes I'm like, how, what were you, like, how? And so again, many people can do the same thing and have all completely different outcomes. Again, going back to my friend in high school who the first time she had sex, she got pregnant, right? And she was like, I was the one who waited longer than the rest of you, blah, blah, blah. I was like, see, and it's not a reflection of anyone's character, right? Things happen. That's one of the things that I think Kerry mentioned this earlier. This is part of what can happen as a result of sex, intimacy, being human, right? Illness can happen, pregnancy can happen, things that aren't so fun can sometimes happen. Things that require us to pivot and kind of change the way that we do things can happen, and that's okay. And it's not. I think that's the main thing I would want anybody to take away, is that you didn't do anything wrong to receive your diagnosis. You just received a diagnosis. That's all. Yeah.
Anybody else? Sarah?
No, that was way too perfect. I'm not following up on that.
Terica, you got anything you want to add?
Terica, you want to try to top that one?
No, Kerry. Well said.
I agree. You hit it nail on the head. And I just, a small thing I wanted to add to it. My friend who had herpes was 22 and had waited longer than any of us as well. So just to reinforce that point, that sometimes the luck of the draw is the luck of the draw. And it doesn't mean it's anything about you. Still stand strong. It's going to be okay. Any other questions?
There was some questions. I'm not sure I fully understand. There was a question around the global discourses of who should and should. I think it's supposed to be who should and who should not have kids.
Interesting. Because see, my next question that I was going to ask, or statement I was going to put out there, was climate change affects my desire to have children. And I think about this because as I was doing research for this topic today, I came across some interesting like points where we are talking about overpopulation, but then we're talking about underpopulation. That there are many countries that, especially here in the Western world, that are completely not going to be able to reproduce themselves, where we are at like less than a reproductive rate that is going to sustain society. And then there are conversations that we've all heard about, we have 8 billion people on the planet and, the world is dying. And so I think about what that really is meaning. And I think that ties into the question, this idea of this global understanding of who's allowed to have children and who is not. For example, China is hit their peak right now. I think they hit 1.8 million people, and they are expected to decline over the next course of the next 5 years and onward. And India is actually expected to become the global leader, and the global country that's populous is now going to exceed China with over 1 billion people. And so when we think about those statistics and what that means for the world and how it ties into, I think the conversation has to go around, how does this tie into the financial and capitalist system that exists in fact. One of the articles that I hit was one by a baroness. I think I just like saying that, baroness. Her name is Baroness Karen Brady. And she seems like a very interesting woman, but she said, the title of this article is, "Women Give Birth to Every Taxpayer on the Planet, and We Deserve a Break." And I thought how wonderfully interesting that is. Do women control the power of the reality of this world, or at least the capitalist system anyway, with the power of our wombs? When we decide not to have children, we shift whole economies. And I think that's what we're talking about now. It's about where we value life and how we value life. And I know that some of the discourse I was hearing was around, India's now going to become, the most populous country, but they didn't think they had enough infrastructure or modernization to support this growing space, because what they saw are workers. What they're saying, from the think tanks that kind of start to orchestrate the world, they're talking about that there's not been a match or a meeting of where their educational systems and all the things of India are going to catch up to it. So there's some fear around what's going to happen. And then let's add in climate change, which is affecting many countries in the world in such prolific ways, and what that's going to mean for migration of people. And we know that we haven't put the right, it's pretty guaranteed that in the next 5 years, I'm knocking on wood beside me, that we're going to hit the 1.5 degree Celsius mark, which is considered a major climactic change. And if it does hit that, we are going to see mass migrations of people all over the world. And so I think that this idea of wanting birth and how we are perceiving life is something that maybe we want to talk about and shift. What it comes to mind for any of you guys? Any thoughts? Does the audience have any thoughts? Any comments?
I do. Number one, why live in fear? And the world has always been changing. Our great grandparents feared what we deal with now. And talking about the population, there's a really good documentary. China is, they're dealing with the aftermath of that one child law that they forced upon their people for, I think, what was it, 25, 30, 35 years? And that documentary gets deep. Like, a lot of people were sterilized, and, so every time man tries to get in there with their little fingers, and I refuse to live by fear.
I really agree with you in that. To be honest, Kai, I think that, again, it's like knowledge is the power here. And what I take when you, for example, mention, the one-child policy in China, and we take a look at why there's this now new outcry around underpopulations. I think it's time for us to take an examination of the systems that exist. It's really not that we're overpopulated or underpopulated. It's that the system that exists is not sustainable within the model we have created. And that's really what the problem is. If we have less people coming into the world or into different parts of the world, that's not necessarily a bad thing. Or I think about it as, why does this feel like it's a bad thing? Why are we raising these alarms? I mean, climate change is maybe a little bit more of a challenge, but the way to meet fear that I've always understood is to tackle it head on and break it down piece by piece. We know what is about to entail. And what we really should be looking at is, instead of the fear and beating the drums, what can we do to offset and mitigate? What are the systems that may need to be looked at and examined? And we're going to have to take some hard changes to how they show up. That's what I see. And I think that as we move forward, it's going to be interesting to talk about, how are we going to value life? How do we allow this experience of choice and opportunity to mitigate the reality of some of the structures that are very hard to crumble, but need to? Just my 2 cents.
I totally agree, but like, none of this, it didn't just happen. Like, it's been building for years. A couple things. Climate change is very real, but we too played a part in that. Like, everything, we were warned. Al Gore put a film out and they laughed at him. Now they're studying that film to try to learn. And I was watching a documentary. I like documentaries. And what was it, a year or two ago, Iceland volcano erupted, and they said that hadn't happened in like, what, 20,000 years? So it's definitely real. And what can we do? I think that, like you said, it's the system that needs to be changed. But the thing is, some people are going to have to take some food off their plate for that to happen. And that's where it's like, yeah, I'll keep me and mine full. So that's all I have to say.
I'm hearing you, and I think you make some very valid points, Kai. Very, very valid points.
I just, if you don't mind, just in terms of what's being said, I think there's a lot of preoccupation with, whether or not having kids, whether or not to have kids, whether or not to have kids. We're so consumed by reproduction that but we kind of stop there. Once the baby has been born, we stop caring about, and I think that's sort of what the both of you were sort of getting at in terms of, and a lot of the people who are making the policies and talking about this are also the ones that are saying, are making these decisions around the womb, are also the ones who, I think, as Kai put it, need to take a little bit of food off their plate, and they're not the ones sharing the resources to then raise these babies. So So there's that. I mean, even just here in the Niagara region, in terms of caring for folks, you mentioned the migration. We have a unique situation now where we are seeing a huge, like very sudden influx of asylum seekers in the Niagara region. And the way, I mean, some of the responses from the community has been, well, I mean, blatantly racist. But like, you know, what can we do as a community to support people who have been displaced? And we're so preoccupied with making babies that we're not even caring for the humans that are already here, that already exist. So, and that's something that I think, again, another question that we need to all ask ourselves is, in what ways can we support the life that already exists here?
I agree. It's interesting when we think about the ways that we hold life and what we value in the ways that we sit in life. And I noticed that I saw a hand up from Megan. I don't know if Megan, you had a comment that you wanted to make?
I think I was just clapping.
Oh, okay. See, I didn't have my glasses on, so I might have missed it, but I agree. Love the clap. Kai, I noticed you had, were you clapping too? Was it yours was a clap as well?
Yes, I was clapping also.
Great. I really love how interactive this one is, that we're getting that, like, you know, participation from the audience. And feel free, anybody else, if you have any questions and concerns, we want to hear it. We've got a few more minutes because we are coming up to 9 o'clock. And as much as I'd love to keep you, I think we need to kind of start to wind it down. And so with that being said, if there aren't any other questions that I'm missing,
I would just like to,
go ahead.
how often do you guys have this panel? That's what I was like, is it once a month, every 2 months?
We do Titillating Talks is once a month. It is every third Wednesday. Am I right? Every third Wednesday, right? I just know I show up.
Fourth Wednesday.
So, okay, let me repeat that. It is every fourth Wednesday of the month. We are, again, you can find us if you want to see, if you haven't seen any of the other ones prior to this one, they are all being housed on the Niagara on the Lake website, and also on their YouTube channel. I think, am I correct about that? I think it's both places. So you can catch all the replays. We've done some fabulous talks. Even if I do say so myself, they've been absolutely amazing. And we will be continuing the series forward. We've got a couple more to go next week. So, wow, next month, we are doing workers and workers' rights. I think that one is going to be very powerful. It's going to be juicy, and definitely check us out. So yes, it's once a month at this point. We'll see where it goes though. Got hope, potential, thoughts. Does anybody have any questions? No? So I think we're ready to wrap it up. And I want to leave us with a today I learned from our panelists. What will you take away? Today I learned.
I'd say today I learned, or I guess what I'm leaving here with on my mind. So I recently had a birthday, and I've been reflecting on the fact that I am currently the age that my mom was when she was pregnant with me. And it's always kind of funny because I'm like, she had 4 kids at this age, and I have 0. And so I think, again, one thing I'm really been reflecting on lately, and I'm leaving this conversation with today again, is just thinking about opportunities, choice, options, and that there's different things for different people, right? So I think of my mom, and she's like, when I was in kindergarten, I knew I wanted to be a mom. And I was like, I'm back and forth every week of whether or not I want kids. So again, just kind of seeing how she lived out, her wants of motherhood, and I'm kind of living out my wants of choice of still getting to take time to make decisions without people being like, oh my gosh, you're this age, how do you not have kids yet, right? And so just thinking about the grace I've been given through my family to be able to really have that decision be one of my own is something that I'm thinking a lot about today after this conversation.
So good, so good. Terica, today you learned or you want to take away?
I want to take away the fact that each person has a right to make their own choices. And I have to accept it and live with it. No one makes my choices. I do. They do have their own rights.
Speak on it. So the truth. Sarah, today you learned.
Oh, so many things I'm going to be taking away from this. It's always such a pleasure to be able to have conversations with such powerful women, and I so appreciate having this opportunity, and also recognizing that I'm able to be in this space because a certain amount of privilege that I carry, and I know one thing, and we didn't really get a chance to talk about it, but I guess what I'm reflecting on most of all is people who don't get to be in these spaces, and how do we create more spaces for more of these conversations so more people can be part of these conversations, in particular, especially when we're talking about sexuality and reproductive health. Oftentimes, trans, non-binary, and two-spirited folks are left out of those conversations, or and not even just left out, but pushed out of those conversations. And just recognizing how important. So kind of how do we create more of these spaces and expand these spaces for these conversations? The whole reason to have the Titillating talks and why we wanted to get together monthly was to be able to talk about things that needed to be said, but you're not polite to say, so those conversations. But how do we create more of these spaces, and how do we expand them and invite more people into those spaces is I think what's going on, what I'm feeling right now.
And as very often, it's so interesting, Sarah and I will be like sharing kindred thoughts. I tell you, we channel each other, and I'm leaving with very much the same sense. As we went through this conversation, that I think for me, it's the sense of knowing how knowledge is power, and that as we have these conversations, it does become more front facing. And I am thinking about all of our queer community, our, the conversations for our non-binaries and our trans folks that are not getting mentioned. And with it not getting mentioned, it's getting drowned out by a lot of negative and unsafe spaces. So for me, it's about us really, and I agree, creating more of these spaces so that we can take up the space. Because if we can fill it with this kind of goodness, we won't necessarily hear all of the dribble, drabble, and humdrum stuff that sits out in the world. There's no fear here. We're about to make new opportunities. And I appreciate every single one of you. Thank you. And with that, I think it's good night.
Thank you, Kerry. Thank you, everyone.
Thank you, everyone. Good night.
Yeah.
Have a good night.